Gaza, the health system is destroyed. Only 7 hospitals are still working. There are 17,000 cases of disease from rats and insects. The world, 266 million people are hungry. 2 famines happened at the same time. In 2025, Sudan and Gaza. It had never happened before. Darfur. It is 20 years since the first crisis. The same violence is happening again today. 245 children were killed in 90 days. Conflict zones. 50,000 children killed or hurt since 2020. 6 in 10 were hurt by bombs and explosives. In Gaza, 40,000 children have lost limbs. Syria, people are disappearing in Al-Massacre. 7,000 people were moved to Iraq without consent. Israeli forces are now inside southern Syria. Cuba. 6 months ago, Hurricane Melissa hit the east. 2 million people were affected. Today, recovery is slow and people still need help. Now, everything you need to know, briefly and to the point. This is Human Rights Weekly. Subscribe to our channel. And now, let's begin. This week, the World Health Organization gave its latest report on Gaza. A senior WHO doctor visited Gaza for the first time. His name is Dr. Grenier van der Wert. He is the WHO representative for the occupied Palestinian territories. He found a health system that is almost completely destroyed. Before the war, Gaza had more than 250 health facilities. Today, only 7 hospitals are working. And they are working at only a very basic level.
1,800 health facilities are partially or completely destroyed. And that ranges from big hospitals like Al-Shifa in Gaza City to smaller primary healthcare centers, clinics, pharmacies, and laboratories.
A new disease crisis is growing inside Gaza. In 2026 alone, 17,000 people have been infected. The infections come from rats and insects. This happens because the water and sewage system is broken.
Cases of rodent and what we call ectoparasitic infections have been reported so far in 2026. And this is just the unfortunate but predictable consequence when people live in a collapsed living environment.
The doctor also described the physical danger everywhere in Gaza. There is explosive ordnance every 600 meters. Health workers cannot reach patients safely. Aid trucks cannot reach hospitals safely. The WHO has estimated the total cost of the destruction, $1.4 billion of damage. It will cost $10 billion to rebuild over 5 years.
Damages to the health sector alone are estimated at $1.4 billion. More than 1,800 health facilities are partially or completely destroyed. And that ranges from big hospitals like Al-Shifa in Gaza City to smaller primary healthcare centers, clinics, pharmacies, and laboratories. Total recovery needs for the health sector in Gaza are estimated at $10 billion over 5 years.
The damage to the health sector alone is estimated at $1.4 billion. Rebuilding will require $10 billion over 5 years and cannot happen while the conflict continues. The WHO message is clear. Laboratory equipment and medical supplies must enter Gaza now. Without diagnostics, diseases will continue to spread. Now we look at global hunger. This week, 3 United Nations agencies released a major new report. It is called the Global Report on Food Crisis. This is the 10th edition. It was published on April 24th, 2026.
In 2025, the year that the report covers, 266 million people faced high levels of acute food insecurity across 47 countries, levels that sadly have remained consistently high and nearly doubled compared to a decade ago.
In 2025, 266 million people across 47 countries and territories faced acute food insecurity at crisis or worse levels. This represents the second highest figure in a decade of reporting, 266 million people. That is more people than the entire population of Brazil. All of them did not have enough food in 2025. The main reason for this crisis is conflict. 20 countries had food crisis because of war. The second reason is extreme weather. The third is economic collapse. The report contains a historic finding. In 2025, there were 2 famines at the same time. This had never happened before in 20 years of reporting.
For the first time, there were 2 famines confirmed in the world, one in Sudan and one in Gaza. This shows that the situation is getting more severe, that food aid needs are becoming more severe.
For the first time in over 2 decades, 2 famines were confirmed simultaneously in Sudan and in Gaza. This is a devastating indictment of global inaction. The numbers about children are also very serious. 35.5 million children under 5 were malnourished. 9.2 million pregnant women did not have enough food. 1.4 million people were in the very worst category. This is called IPC level 5. It means catastrophe or famine conditions. This number has grown 9 times larger in just 10 years. The 3 agencies have a clear message to the world. More funding is needed. Aid workers need better access. Without action, the numbers will continue to rise. Today, we go to Darfur. This is a region in western Sudan. 20 years ago, there was a terrible crisis in Darfur. Hundreds of thousands of people were killed. The world said, never again. But today, in 2026, the same crisis is happening again. UNICEF published a report this week. It is called the Child Alert. It is specifically about Darfur. It is specifically about children.
20 years ago, Darfur shocked the world. An entire nation of children became victims of survivors of terrible atrocities. Today, as the war in Sudan moves into its 4th year, history is repeating itself in the darkest possible way for children in Darfur.
20 years after the world first pledged never again, in Darfur, history is repeating itself. 33 million people need humanitarian assistance. Half of them are children. In just the first 90 days of 2026, 245 children were killed or seriously injured. Famine has been confirmed in the city of Al-Fashir. Al-Fashir has been under siege for more than 1 year. Children there are dying of hunger right now.
Famine conditions were confirmed in Al-Fashir in November of last year, and malnutrition rates among children have reached catastrophic levels in parts of Darfur, where acute malnutrition rates exceed 50% in some locations.
Famine was confirmed in Al-Fashir in November 2025. The city has been under siege. Children are dying of starvation. This is not a food shortage. It is man-made. Education has also been completely destroyed. There are 4 million school-age children in Darfur. 3 million of them are not going to school. That is 75% of all school-age children. UNICEF made an emergency appeal for 2026. It asks for funding to help children across Sudan. Today, only 16% of the needed money has arrived. UNICEF is calling on all armed groups to stop attacking children. It calls on donor governments to fund the emergency response. Time is running out for the children of Darfur. Now we turn to a global crisis. It is about children and weapons. A new report from Save the Children was released this week. It looks at 5 years of data from 2020 to 2024. It covers 11 of the most dangerous conflict zones in the world.
Over 50,000 children in that time frame were killed or injured, and nearly 60% of them were killed or injured by explosive weapons. The data from the 2024, the last data that we have at this moment, is that 12,000 children were killed or injured, and 70% were all of these casualties were caused by explosive weapons.
Between 2020 and 2024, over 50,000 children were killed or injured across 11 major conflict zones. 60% were killed or harmed by explosive weapons, bombs, shells, landmines, and IEDs. 50,000 children in just 5 years. 6 in every 10 were hurt or killed by explosives, not only in Gaza, in 11 conflict zones around the world. In 2024 alone, 12,000 children were affected. 7 in every 10 were hurt by explosive weapons. The situation in Gaza is the most severe in the world. More than 40,000 children in Gaza have lost a limb. This is the highest number in any conflict in modern history.
Of course, Gaza is the place with the largest cohort of child amputees. The data from last year, we have that over 40,000 children estimated to be injured. And of course, the data even from the first weeks of escalation in 2023 shows that thousands of children lost their one or two limbs.
In Gaza alone, more than 40,000 children have suffered limb loss or damage. The scale of this is completely unprecedented. These are children who will live with lifelong disability. In Afghanistan, one child is killed every single day by explosive ordnance. These include landmines left from decades of war. Children find them in fields and on roads. There is also a positive story today from Colombia. Colombia has created a new model for clearing landmines. Former fighters from the FARC peace agreement are trained as deminers. They know exactly where the mines are. Now they are removing them.
In the case of Colombia, what has happened is that the perpetrators of the violence in the communities are sentenced, in a way, to go back to and help with the recovery and restoration of those communities, including through demining and mine action, victim assistance, risk education. It's a way of incorporating, instead of penalizing the ex-combatants by putting them in jail, it's really incorporating them to be a part of the community and to go back and to make amends alongside the members of the community.
Colombia is pioneering a model where ex-combatants become deminers. These are people who know the terrain. They are now protecting communities instead of threatening them. But funding is a serious problem globally. Victim assistance programs receive only 5% of all mine action funding. Children who survive injuries get almost no long-term support. Syria. The conflict changed in 2024, but human rights violations are still happening today. A United Nations team visited the region of Al-Hasakeh. Al-Hasakeh is in northeastern Syria. The UN team documented serious human rights violations. People are being killed. People are disappearing. People are being detained with no legal process at all.
Our colleagues in Syria have just concluded a visit to Al-Hasakeh Governorate in the northeast of the country, where they received first-hand testimonies and accounts of past and present human rights violations and abuses. These include reports of significant numbers of killings, enforced disappearances, arbitrary detention, and deportation of detainees.
In January 2026, something very significant happened. A coalition moved 7,000 detained people from Syria to Iraq. Half of these people were Syrian nationals. They were transferred without their knowledge or consent. In southern Syria, there is another serious development. Israeli forces have expanded their presence since late 2024. The United Nations says this is a violation of international law.
We are receiving mounting protection concerns for civilians in southern Syria, where expanding operations by Israeli forces occupying these areas are placing lives at risk. Rights to family life and privacy are being curtailed, and livelihoods, particularly in agriculture communities, have been seriously impacted.
Israeli forces continue to expand their presence in southern Syria. We have also received reports of a chemical substance being sprayed on agricultural land. In February 2026, these must be independently investigated. In February 2026, an unknown chemical substance was sprayed. It was sprayed on farming land in southern Syria. Farmers have lost their crops. The UN is calling for an independent investigation into this incident. The UN also addressed the situation in the occupied Syrian Golan. Israel is conducting development activities in the occupied Golan. The UN says this is illegal under international law. All construction in occupied territory must stop immediately. Our final story today comes from Cuba. 6 months ago, Hurricane Melissa hit the eastern part of the island. The hurricane struck in October 2025. It was one of the most powerful storms to hit Cuba in decades. The scale of the disaster was enormous. More than 2 million people were directly affected. Hundreds of thousands of homes were completely destroyed.
6 months ago, Hurricane Melissa made landfall in coastal and fishing communities across eastern Cuba, affecting more than 2 million people and leaving widespread destruction, particularly in Santiago de Cuba, Granma, and Holguín. The storm destroyed hundreds of thousands of homes, affected more than 700 health facilities, and severely disrupted water systems, with nearly 100 pumping stations impacted.
Hurricane Melissa affected more than 2 million people in eastern Cuba. More than 700 health facilities were damaged or destroyed. 6 months later, recovery remained slow and deeply uneven. 700 health facilities were damaged or destroyed. People cannot access basic medical care in many areas. There are fuel shortages, ambulances and generators cannot work. Aid organizations have been working in the affected provinces. So far, 45,000 people have received essential services, but the total population that needs help is much larger.
Although the appeal remains significantly underfunded, it has enabled us to support the Cuban Red Cross in assisting nearly 45,000 people with essential services, psychological support, and relief items, including hygiene kits, mosquito nets, and shelter materials.
The IFRC emergency appeal for Cuba remains significantly underfunded. Without increased international support, the recovery will continue to be slow and incomplete for millions of people. The Red Cross emergency appeal is seriously underfunded. Donor countries need to send more support to Cuba. Without it, 2 million people will continue to struggle. Today we covered 6 stories: Gaza, the food crisis, Sudan, children and explosives, Syria, and Cuba. These are all real events, all documented by the United Nations. Human rights matter everywhere, not only in countries we know well. If this program helped you understand the world better, please subscribe. Share this video with someone who needs to know. This is Human Rights Weekly. We will see you next week.